Okay, so rheumatoid arthritis is typically going to be a secondary diagnosis that goes with another diagnosis that you'll be treating them with. So one of the main things with rheumatoid arthritis is we want to protect those hand and finger and wrist joints. So if you're treating them for another pathology, and say you're doing like shoulder flexion, typically you would just give the patient like a weight or a TheraBand, and they would grip it, and then they would do their exercise like that. But the gripping and the active gripping can be hard on a patient that has RA because it's hard on those joints. It can cause more inflammation. So if you have that, you could just do a cuff weight instead. So that way they're not having to actively grip the weight. So then they're able to focus on just using those larger muscles to do the action. So then specifically when you're working with someone with RA, a lot of the focus is on active range of motion. So you don't want to be stretching those joints because you might sublux them or anything like that. So a lot of the focus is on active range of motion, just however much they can do themselves. So some exercises that you could do, if you start with their hands flat on the table, you're going to keep the wrists in a neutral position, and you're just going to lift each individual finger as much as they can off the table. We don't want to force it, so you want to make sure and remind them that we're not trying to really stretch and get as high as we can. We just want to actively get that motion going. Because if they go too far, they can cause more inflammation and more pain. So we want to focus on just range of motion. Another one we can have them do, they have them put their elbow up on the table. They can start straight, and then they're just going to curl their fingers as much as they can and back up. Like I said before, only as far as they can go, because we don't want to force anything, cause any subluxations or anything like that. So we usually want to remind them to be slow and controlled so they don't accidentally force it too far and cause more inflammation. Another one that we can have them do, they have their palm flat on the table. You can do finger touches to each individual one, just as far as they can go, still not trying to force anything. So that's the main thing with RAs. We want to work on active range of motion. We don't want to stretch anything and cause any more problems. If they are having any inflammation or pain, we want to use that PRICE-MIM acronym. So we want to do the rest, the ICE, elevation, taking their RA medication to help with that. Another important thing for someone with RA is we want to do low impact aerobic conditioning. So they might do like swimming or aquatics or cycling or anything like that. So something that's low impact on the joints so we don't cause any more inflammation, because we don't want to overwork anything, but we're still getting that exercise that they need.